Hello, my name is Benzi Kluger. I'm a professor of medicine and neurology at the University of Rochester in New York. I'm going to talk to you today about cannabis and Parkinson's disease. We'll discuss the current evidence and also the hype that is out there about this substance. As a place to start, I think it is important that we are all speaking the same language, particularly as there is some confusing terminology out there. Cannabis is a genus of flowering plants that includes sativa, indica, and ruderalis. Sativa tends to have higher THC, but also contains CBD. Indica and ruderalis tend to have higher CBD. The term hemp is used to refer to cannabis plant that has less than 0.3% THC. And there are other terms out there such as marijuana and reefer that are referring also to the cannabis plant. Cannabinoids are chemicals that act on cannabinoid receptors in the nervous system and other parts of the body. And the original cannabinoids come from plants. They're also called phytocannabinoids. And there have now been over 100 phytocannabinoids described. The two best described and the two oldest that we've known about are delta-9 tetrahydrocannabinol, or THC. And this is the part of cannabis that is responsible for getting people high, but may also be responsible for some therapeutic benefits, including for pain. And cannabidiol, or CBD, which has been getting a lot of attention recently, particularly for its potential for helping children with certain types of epilepsy. And it is a part of the cannabis plant that may help with relaxation. Endocannabinoids are cannabinoids that are produced by the body, by neurons and other cells. And anandamide is the oldest and best described of the endocannabinoids, and anandamide comes from the Sanskrit word for bliss. Synthetic cannabinoids are man-made cannabinoids, some of which are isolates of phytocannabinoids. So marinol, which is the oldest synthetic cannabinoid, is a THC isolate and has been used for a long time for cancer-related nausea and appetite. Epidiolex is one of the newest synthetic cannabinoids, and it is a CBD isolate that is used for certain types of pediatric epilepsy. Nabilone is a cannabinoid agonist, so similar to dopamine agonists, and it has been used for pain and muscle spasticity in multiple sclerosis. Here is a diagram that shows the concentration of cannabinoid receptors in the brain, and specifically cannabinoid receptor 1 in the brain. And you can see that it is located all over the place, but it has very high concentrations in parts of the brain that are important to Parkinson's disease. This includes the basal ganglia, which is also that part of the brain that we target when we're doing deep brain stimulation surgery. The cerebellum, which is important for walking, coordination, and balance. The hippocampus, which is important for memory. The amygdala, which is important for emotions. So just by looking at where cannabinoid receptors are, we might surmise that they are important for both motor and non-motor symptoms in Parkinson's disease, or at least could contribute or have a therapeutic potential in these various symptoms. Not shown on this diagram, but also important, is the CB2 or cannabinoid 2 receptor, which is found on microglia. And these are immune cells in the brain and may be important for claims of the neuroprotective effects of cannabinoids. On the slide here are two experts on cannabis. You may recognize them. They are Cheech and Chong. For people who do not recognize them, these are two American comedians who have built their career on pot-related humor and marijuana-related humor. And I put up this slide just to really bring home the point that medical marijuana is derived from the same plant as recreational marijuana. So some of the effects that we see with medical marijuana are going to be similar to recreational, and some of the side effects that we see would be similar. So if I were to ask people in the audience whether people who smoke marijuana are moving faster or slower, I hope most people would say slower. And part of the reason for that is that if you directly stimulate cannabinoid receptors, you actually decrease dopamine. And in some animal models, cannabinoid receptors are used to mimic the effects of Parkinson's, particularly slow movement and bradykinesia. So the idea that cannabinoids are going to be the answer to all problems in people with Parkinson's disease is certainly a fantasy. That being said, there are a number of cannabinoids, and some of these cannabinoids may have beneficial therapeutic effects, but they certainly will not be able to take away all of the effects of Parkinson's. The second point here is that some of the common side effects that people have heard about before, such as feeling dopey, feeling dizzy, being slow in their movements, being amotivated, are also going to be true for medical products. And so we want to be aware of the side effects of these before we start taking them, and to treat them as the powerful chemicals they are. Just so if you are going to try them, and we'll talk about this a little bit later, you would want to start at a low dose, start slowly, and make sure that your doctor is aware of what you're doing. There have been a large number of basic science and animal studies on cannabinoids and Parkinson's disease. And in general, I would call these studies quite exciting, that they generally support motor improvement, and they are mixed as far as the mechanisms behind that. But I would also say that there are quite a few studies that suggest that at least certain types of cannabinoids may actually worsen Parkinsonism and can mimic Parkinsonism. So this is not a panacea. When it comes to helping people with Parkinsonian movements or slow movements, CB1 antagonists are the most consistently helpful in animal studies, and this probably works through non-dopaminergic mechanisms, including blocking glutamate and through adenosine, both of which have been considered in other contexts. Interestingly, both cannabinoid agonists and antagonists have been reported to improve dyskinesias. And some of these may improve dyskinesias without worsening motor symptoms. So this is intriguing, although still far from proven in people. There are also a handful of studies that suggest that cannabinoids may be neuroprotective. And this may be through a variety of mechanisms. So CB1 receptors increase nerve growth factors in neurons, and CB2 receptors have effects on microglia that may reduce neuroinflammation. There may also be anti-excitotoxic, anti-inflammatory, and antioxidant effects from cannabinoids. So these are promising chemicals, but there have not been human studies yet to back up their potential as neuroprotective agents. When it comes to studies in people, I will start with the headline, which is that there are currently no randomized controlled trials to date that support the use of cannabinoids for anything in Parkinson's disease. These trials were all small. I would call them potentially more fairly inconclusive rather than negative. But they did not find benefit for the specific cannabinoids that they were studying. All of these trials showed that the risk for side effects at doses used for medical indications are real, and these include some of the side effects that you would expect, such as confusion, low blood pressure, and dizziness. So we need to treat cannabinoids seriously, and even though they are natural, that does not necessarily mean that they are safe. That being said, there are a number of case studies and case series that suggest that cannabinoids can be helpful for certain motor and non-motor symptoms, and that, just like the animal studies, suggest that further research is needed. And this includes pain and sleep, and there have been studies outside of Parkinson's disease that have suggested that cannabinoids may be helpful for these symptoms. There are also some uncontrolled studies of REM behavior disorder, restless leg syndrome, and anxiety, suggesting cannabinoids may be helpful. There have been some reports of help for depression, but I would be cautious there in that cannabinoids can also worsen depression in some situations. There have also been a few reports suggesting help for agitation and dementia. And in these studies, it's important to note that it was CBD that was the chemical that was studied. THC has been studied in dementia and can actually worsen behavioral symptoms. There are clinical studies underway. There's a large study happening in Colorado that is looking at tremor and is one of the better designed studies in that it had a dose finding study and is a large study that is adequately powered. But there are other studies underway looking at other motor and non-motor symptoms, as well as looking at neuroprotection. When it comes to practical guidance, and some people may want to try cannabis for certain symptoms, it's important to start by asking why you or potentially members of your family want you to try cannabis. And currently, we would not recommend trying cannabis simply for Parkinson's disease. There is no evidence that cannabinoids help Parkinson's in general, but there is some evidence that it may help specific symptoms. And so if you particularly wanted to try something for pain or for sleep, potentially for smoothing out some motor symptoms that could be reasonable, it's important that you know the laws and the rules in your state and country. You don't want anybody going to jail. It's important that you know how to get a license and how to work with the system in your country. In most states, it's a matter of seeing a physician to get a license and then working with a dispensary to get specific products rather than getting a prescription. The route of administration is important to consider. Topical preparations may be good for focal pain, so using creams or patches. Smoking and vaping can be good for immediate onset and for rapid onset, but could be an issue for people with pulmonary disease. And oral preparations are generally easy to take, but sometimes have delayed onset, can lead to overdose, and sometimes if there are children in the household, can lead to accidental ingestion and toxicity. When we think about what type of cannabinoids to use, CBD is generally a safe place to start and can help with some mild pain and anxiety. THC tends to be more helpful, particularly for pain, and you'd want to add in THC slowly. You'd like to start with a single dispensary and stick with that dispensary because in most countries, this is not a regulated product. And so no matter what it says on the label, you don't know exactly what is in that product. And the difference between the product and the label can be greater than 25%. It's best to start with a low dose and go up slowly and to make sure all of your healthcare providers are in the know when it comes to these very powerful but potentially therapeutic chemicals. I look forward to hearing about your questions and talking to you more during the live Q&A session later in the course.